We are discussing about the heritable ataxic disorder. The ataxic disorder due to genetic in origin, that is inherited. The ataxic disorder that is genetical in origin may be autosomal dominant, may be autosomal recessive, or may be due to mitochondrial disease. Mitochondrial disease. We discuss all these in a sequence. First we will discuss the autosomal dominant disease that cause the ataxic disorders. Autosomal dominant. The autosomal dominant ataxic disorder is also called spinocerebellar ataxia. This is also called spinocerebellar ataxia. That is spinocerebellar ataxia. This is the heritable cause of the ataxic disorder. There are subtypes of the autosomal dominant ataxic disorders. The first number is spinocerebellar ataxia 1. Spinocerebellar ataxia 1, SCA1. The SCA1 present in the middle adult population or early childhood. They are present in the middle adult. They are present in the middle adult population or early childhood or early adulthood. There is spinocerebellar ataxia. That is spinocerebellar ataxia A1. A means that present in the early adulthood or at the middle adult. A1. The symptoms of the SCA1, there is the slowness of voluntary movements. There is the slowness of voluntary movements. The voluntary movements of the patient in cases of the SCA1 are slowed. They become slowed. There is normal reflex, but the knee and ankle jerks are lost. The knee and ankle jerks are lost in the SCA1. There is impairment in the cerebellar and brainstem. There is impairment in the cerebellum and brainstem. Brainstem impairment also occur and cerebellar impairment also occur. The atrophy of the cerebellar and brainstem seen in the MRI. Atrophy occur, and this atrophy can be seen on the MRI in cases of the SCA1. As a result of this, the shrinkage of the ventral half of pons occur. The shrinkage due to SCA1, the shrinkage of pons occur. The shrinkage of pons occur in the ventral half, not the dorsal, in the ventral half. Shrinkage of pons occur due to SCA1. There is the disappearing of the olivary eminence. The olivary eminence disappears. The olivary eminence disappear in cases of the SCA1. Now we will discuss the causes of the SCA1. What are the causes that SCA1 occur? The causes of the SCA1. The cause, this is the autosomal dominant disorder. So there is mutation in the gene called ataxin. Mutation in the gene that synthesize a protein called ataxin. There is mutation. The mutant allele has 40 number of CAG repeats. This mutant allele has 40 CAG repeats. What is the normal CAG repeats in the unaffected patient? The normal CAG repeats should be less than 36. So there is 40 CAG repeats, and there is mutation in the gene that synthesize a protein called ataxin. But the juvenile SCA1 has higher number of repeats. The juvenile SCA1 has higher number of repeats that may be greater than 40 repeats in cases of the juvenile SCA1 disease. Now we will discuss the other spinocerebellar disease that is autosomal dominant in origin, that is SCA3. SCA3. The SCA3 are mainly present in the Cuba population in India. They are present in the Cuba and India populations. The age of onset for the SCA3 is 2 to 65 years. Age of onset for SCA3 is 2 to 65 years. That may occur in the children and may occur in the adults or elder people. What are the causes of the SCA3 disease? So there is mutation in the gene. This is autosomal dominant disease. There is mutation. There is mutation in the gene that synthesizes protein. The protein is ataxin, and there is mutation in the ataxin 2. Mutation in the ataxin 2. The normal ataxin 2 has 15 to 32 repeats. The normal ataxin has 15 to 32. The normal ataxin 2 has 15 to 32 repeats of CAG. But in this cases of the SCA3, the mutation has 35 to 77 repeats. In this SCA3, there is more than 35 to 77 repeats of CAG repeat sequence. The repetition increases that cause the SCA3 disease. Now we will discuss the SCA6 disease. SCA6 disease, spinocerebellar ataxia 6. The SCA6, this is the autosomal dominant, and there is the vibratory and proprioceptive sensory loss. The symptom of SCA6 is vibratory and proprioceptive sensory loss occur. Vibratory and proprioceptive sensory loss occur. This is the autosomal dominant disorder, that is SCA6 spinocerebellar ataxia 6. This is the autosomal dominant. In the SCA6, the mutation occur in the alpha 1A voltage dependent calcium channel. There is mutation occur in the alpha 1A voltage dependent calcium channel. So this is also called CNA1A gene mutation. CNA1A gene mutation in the disease SCA6 disease, spinocerebellar ataxia 6. Normal population, the CAG repeat sequence is 4 to 16. In this voltage gated dependent calcium channels, and in this gene CNA1A gene, the normal repeat sequence is 4 to 16. But when mutation occur, this is the normal. When mutation occur, the repeat sequence increases in this gene, and they increases, and they are 21 to 27. In the mutation, they are 21 to 27 repeat sequence of CAG in the gene called CACNA1A gene, that is alpha 1 A voltage dependent calcium channel. The missense mutation may also occur. The missense mutation may also occur in the SCA6 disease. The missense mutation may also occur. The missense mutation may also occur in the SCA6, but they are associated with familial hemiplegic migraine. When the missense mutation occurs, they are associated with the familial hemiplegic migraine. Now we discuss the SCA7, spinocerebellar ataxia 7. The spinocerebellar ataxia 7, there is retinal pigmentary and macular degeneration. The retinal pigment degenerate. Retinal pigmentary degeneration. There is also macular degeneration. The SCA7 occur due to a CAG repeat sequence mutation. They occur due to mutation. This is the autosomal dominant disease. There is mutation occur, and CAG repeat sequence increase. CAG repeat sequence increasing in the SCA7. So this CAG repeat sequence increasing. The mutation occur in which gene? Mutation occur in the SCA7 gene. This mutation occur in the SCA7 gene. This is simple name SCA7. In the SCA7, their mutation occur in the SCA7 gene, and the CAG repeat sequence increasing in number. This disease is mild and adult. This disease is mild in the adult and severe in the elderly. Elderly population has severe symptoms. This disease is mild in the adult in severe, not in the elderly, sorry, this is severe in the childhood, severe in the childhood. When the diseases occur due to HCA7 in the childhood, this symptom must be severe, and when occur in the adult population, this is mild symptoms of ataxia. In this disease, the ataxin 7 accumulates. In this disease, the ataxin 7 accumulate. Ataxin 7, due to the ataxin protein fragments break down and ataxin 7 accumulates. The ataxin 7 accumulates, and this ataxin 7 when accumulates, they cause the toxicity to the neuron. They are toxic to neuron. They are toxic to neuron. Some research suggests that there is the paternal transmission mostly occur. Paternal transmission, this is the autosomal dominant disease, but some studies suggest that the paternal, due to father, paternal transmission occur mostly there is paternal transmission according to some study, and we will discuss now the SCA8. SCA8, spinocerebellar ataxia 8. The spinocerebellar ataxia 8 this occurs due to CAG repeats expansion in the untranslated region on the chromosome number 13. This occurs due to CTG repeats. Due to CTG repeats sequence of in the untranslated region on chromosome number 13 and Q21. This is the part of chromosome number 13 and Q21. In this the CTG repeat sequence occur in the untranslated regions of chromosome number 13 Q21. Study suggests that the maternal basis transmission is common. Maternal basis. SCA7 due to paternal and SCA8 due to maternal. Maternal transmission is common. The symptom of SCA8 is gait ataxia. Gait ataxia, and the age of onset is 40 years of age. SCA8 occur. SCA8 occur up to the main age is 40 years of age. SCA8 occurs. Spinocerebellar ataxia 8. But the range of age is 20 to 65 years. 20 to 65 years. But the mean age is 40 years of the age. And range from 20 to 65 years of age, these symptoms of SCA8 occur. This is the autosomal dominant disease, SCA8. and myoclonic dystonia sometimes occur. Myoclonic dystonia sometimes occur. So this was the heritable ataxic disorder.